So let's continue to talk about our periods as report cards. Some of the questions you should be asking yourself as the report card monitor. Are my periods regular? Are they painful? Are they long? Are they heavy? So if you answered yes to painful or heavy, that's not normal. Having cramps with our periods is not normal. Having regular periods, light bleeding, is normal. So one of the things that you want to ask yourself is, do you ovulate? And we've talked about that before in other videos about how to tell if you have ovulated or not. Ovulation happens approximately 16 days before we start bleeding again. So the average is between 10 and 16 days. It can never be, our period can never start more than 16 days after we ovulate. So we can have a long first half of our period and have longer cycles, but we can never have a period that starts after 16 days from ovulation. So anyway, how do we tell if we ovulate? Remember, we talked about the increase in the egg white consistency discharge that happens right before ovulation. And then we talked about the minute temperature increase that happens right after ovulation and continues to be increased until we start our period. So regular anovulatory cycles can happen. So if you're not ovulating, you still can have a bleed. But what happens is the first half of that cycle is very long. So it's just an extended length of time for that first half. And then we have breakthrough bleeding, which we think is a real period. Now, the problem with that is that we don't produce progesterone if we don't ovulate. So then the lining of the uterus builds up. We have the heavy, the crampy, the clotty periods. Now, anovulation can be normal on occasion. So sometimes even healthy women have a cycle that they don't ovulate in, but it's the prolonged, regular happening of not ovulating that becomes an issue. In our next video, we're going to talk a little bit about what happens when you don't have periods, when you've already started and then all of a sudden they stop, or maybe you are a teen, late teen, and you have never started your period.